Guess the topic. A famous city in Scotland. Yes, we are talking about Glasgow. And what we'll be studying today will be GCS, Glasgow Comma Score, with the help of 4 MCQ and important updates in GCS score. Let's start. First question. A patient who sustained RT was brought to ER in a semi-conscious state. He makes incoherent sounds, localizes to pain, and opens his eyes to pressure. So let's first study GCS score and then solve the MCQs. Look at this. What is this? EVM machine, and those are the three components of GCS: eye opening, verbal response and motor response. EVM. Now the ones shown in red are the important changes that have been made. So the change in eye opening is from pain, it has been changed to pressure, and the response in verbal is inappropriate sounds is V2. There is also important update in form of pupil reactivity score, which we will be dealing further in next slide. So the next important MCQ point, which is the most important component. So M for motor, M for most important. So motor is the most important prognosticating factor. And here is my key for you to solve the MCQs: P2, S2, W4. So what is this code? These are the most common components which have been asked repeatedly in MCQs. What is P2? So wherever you see pressure, the eye opening will be 2, so it will be score of 2. S2 is sounds, and 2 plus 2 is 4, so withdrawal 4. So these are the common points which are put in the MCQs and asked repeatedly. Now let's come to our question. So incoherent sounds, as I said, so it will be 2. Opens his eyes to pressure, so again it will be 2, and localizes, this will be 5. So 2 plus 2 plus 5, and the answer here will be 9. Next question. 42-year-old man intubated after traumatic brain injury, and I have already highlighted what we have discussed. So opens his eyes to pressure, so 2, and withdraws his left arm, so 4 plus 2, 6. Remember, whenever there is intubated or tracheostomy, it will be mentioned as T, and it will not be taken into consideration for counting the total score. So it will become 6T in this patient, and the answer is 6. Now, as I said, there is an important update. What is it? It's a pupil reaction score. And how do we learn it? Remember, it's the reaction of the pupils which is subtracted from the total score and not added. So if both the pupils are not reactive, 1 plus 1 2, if one pupil is not reactive, 1. So this will be subtracted from the total GCS score, and if both the pupils are equal and normally reactive, there will be 0. So there will be no subtraction from the total GCS score. So remember that GCS pupil reactivity score will bring the GCS down. Now a very simple question and should not be made a mistake. What is the minimum GCS score? 1, 2, 3, 4. Don't fall in the trap of 1. The minimal GCS score, the minimum components for each score is 1, 1 and 1 for EVM. So the minimal score would be 3. Now, how do we divide these injuries? Whether on the depending on the basis of GCS, how do we divide them? So remember, GCS total score is 15. That is a maximum score, and minimum score will be 3. So if it is 14 to 15, it's a mild injury. 9 to 13 is moderate, but this is important for us. 3 in our MCQ, and 8. What is the significance of 8? Score of 8 or less is an indication for intubation. Again an MCQ point. And remember, lower the score, poorer the prognosis. So the minimum GCS score is 3. Last MCQ. GCS score in severe head injury, we already studied. It is 3 to 8, and 8 is for intubation. So two important image based question: decorticate posturing and decerebrate. Decorticate means flexion, that is M3, and decerebrate means extension, that is M2. Just briefly understanding the mechanism, midbrain is the side of red nucleus and rubrospinal tract which causes flexion. So any injury at the brainstem, especially midbrain, will cause rubrospinal tract to be injured. So the flexion will be lost and the vestibulo will take place and it will lead to extension. Another important point, M3 has a good prognosis, M2 will have a poor prognosis. And lastly, leaving you with this quote, if you cannot do great things, do small things in a great way. Just like our GCS score looks simple, but the MCQ should not be missed. If you like it, please share and subscribe, and you can also follow me on Instagram handle. Thank you.